All right, I've got my trusty spine here. We're gonna talk about the number one sign and symptom related to spinal stenosis. This is the most classic sign and symptom. And when people say this in front of me, when I'm treating them and they're like, hey, I'm having this, I'm like, woof, that is almost 100% indicator of spinal stenosis. Let's go over that one sign and symptom and some things that we could do to help improve it. All right, so I've got that patient in front of me and they're like, hey, when I walk, I notice that my back symptoms and my leg symptoms, or just my leg symptoms, really increase. Things get tough and they get tough quick. But when I walk, and those symptoms start to increase in my leg. They could be pain, that could be numbness and tingling. But the weird thing is that when you sit down, the symptoms go away immediately. And so that they're always finding themselves looking for a cart to lean on or a bench to sit on. And that when they have those intense symptoms, could be numbness and tingling, could be pain, they have immediate relief when they sit down. And it's a wild thing because you wouldn't expect tissues to change that quickly. But what we see is that that's called neurogenic claudication. And that neurogenic meaning you have neuro symptoms of origin. Claudication means that since nerves need space, movement, and blood flow, the blood flow and the space is decreasing a little bit when you stand. And that when we stand, that's more of an extension-based task. You arch backwards a little bit when we stand, right? We stand up tall and gravity's fighting down or pushing down on us. And those nerves become a little ischemic or compressed in that they're lacking some blood flow. And that's what gives you the symptoms down the leg. And that's what gives you troubles when you walk. And so when you walk, those symptoms start to increase. But when you sit down, you have immediate relief. That's the key. You have to have immediate relief. I say immediate, but it's like less than a minute, 30 seconds, 20 seconds, 10 seconds. I've seen it all. But when you sit down, those symptoms go away immediately, which is a really weird thing, an interesting phenomenon. And that what we're trying to do in those patients is trying to reduce the discomfort and improve their walking ability. And so I've done a past video of things you shouldn't do when you have that. But when we have that, it's okay to walk. I can tell people all the time that, hey, you're not doing damage when you walk. It's just your body's having difficulties doing it. So this is how I frame it to them. And so if you want to improve your walking ability and that pain down your leg, then you walk. And then when you start to have symptoms, you sit down. You sit down immediately. That said, when you sit down and those symptoms go away, you want to get up right away and you want to start walking again. And so let's say you start being a little scientific about it and you notice that, hey, I can make it to my mailbox before I have symptoms. Okay, so I'm going to tell you, take a chair with you, take a little folding chair, go to the mailbox. When you have symptoms, when you get there, sit down. And when those symptoms go away, stand back up and start walking. And what you notice is that over time, weeks or so of doing that and increasing your walking distance and tolerance, you'll notice not only will your walking distance improve, but your symptoms will improve. So maybe you had an 8 out of 10 pain of walking that long. You'll notice that your symptoms are maybe a 5 out of 10, and then a 4, then a 2, and then maybe it goes away immediately. But you can train your nerves in your body to have less discomfort and improve your ability to walk. And so that's the number one thing that people with spinal stenosis tell me is that I can sit all day long. I can sit in my favorite chair. I can sit in the couch. I can sit in the car. But when I go and get up and walk, things get a little spicy. And that's you notice that those leg symptoms really start to increase. And so it's absolutely okay to train your body to improve that because it's a space issue. And when you stand up, you have a little decrease in space. And then when you sit down, you have a little increase in space. The space in our lower back increases. And so when you have neurogenic claudication and those leg symptoms when you walk, the 1-2 punch is that I tell you get on a walking program. I'm like, hey, this is the walking program that I previously described. That's what you're going to do. And then we're also going to work on improving your hips. So if maybe your back can extend a little bit less when you walk, if we improve some hip strength, right? So we improve our ability that leg get behind us, and because striding out and have a longer stride can be uncomfortable. And that's why you would tend to lean on a cart or a rollator and try to lean forward and do that. And so when you're walking and having difficulties in the leg pain, we want to improve your ability to walk and your body's ability to tolerate those symptoms. But then we also want to work on hip strength and the ability to get stride out a little bit. And then the last thing that I try to bring up when the time is right is that the extension of your back is caused by walking, right? But can you think of something else that would cause more extension in your back? Well, if you had extra weight sitting in here, right, that's gonna pull you more forward, and that's only going to increase those symptoms in your lower back. And so when we're working with a person, we take their individual factors into consideration, but the top two things that I start working with is the hip strength and then improve the ability to walk by getting on a good walking program. I know it seems counterintuitive, but trust me, it works. And so work with your local physical therapist to help figure out those exact symptoms and exact ways to do it. But when we improve leg strength, hip strength in particular, and we improve our ability to walk and get our body used to that and train our nerves, the symptoms improve overall. So the number one sign and symptom is neurogenic claudication, very normal, very treatable. And you want to start off with conservative measures first that include physical therapy and other movement professionals. And so reach out if you have any questions and comments, concerns. It's an interesting thing. And if you watch this entire video, I hope it makes sense, but I've just seen it so many times when I'm treating clients. It can improve, but it does take some hard work. And so if you have any questions or comments, please leave them underneath the video in the description. If you guys find this information useful, please subscribe, support the channel, and be greatly appreciated. And as always, guys, stay healthy, keep moving, and take care of yourself.